to that. So if you or your kids are homesick right now, or you have been recently, you're not alone. Doctors here in Central Indiana say they're seeing a spike in patients with respiratory illnesses, which includes RSV, and hospitals are seeing this spike too.
And just yesterday, we told you Riley Hospital for Children is restricting visitors until they see things calm down. So today I talked with a pediatrician, Dr. Eric Yancey, about what we need to know, especially as we head into the holidays. Dr. Yancey, what are you seeing right now?
We're seeing a fair number of respiratory viruses, some of them just plain old run-of-the-mill colds and just the usual stuff. But we're also seeing a pretty good number of children with respiratory syncytial virus, or RSV, as is more commonly known.
How severe is that? How dangerous can that be?
It varies. It can be very dangerous in some of the very small infants. For instance, like the prematures that go home, it can be deadly. But it can also be very serious in some of the younger infants who are full term. And most of the time, by the time you get to the older child, it's not as severe. So it's usually kind of a disease of extremes. It can be bad, I understand, in much older people as well as like the young babies. And it can be devastating. There are nationwide, there are a number of deaths every year from it. But the disease burden is pretty big.
So as a parent, what do we need to be looking for or listening for?
Well, I think that one of the things about respiratory syncytial virus, or RSV, is that you're going to have, the child is going to seem to be having difficulty breathing. Frequently you hear a wheeze, almost like an asthmatic wheeze, where they have the kind of type situation going on. Struggling to eat. One of the big hallmarks in the younger infants, they just stop eating. There's so much energy used for breathing, they just stop eating. Also things like pulling in of the chest, what we call retractions, flaring the nose, just trying to get air, and just that general sense of this, I don't feel well type of sense. And if any of those things are going on, I think they should absolutely seek medical care.
In terms of prevention, what can we do? Obviously, we hear the same thing every year, right? Wash our hands, stay home when we're sick. Anything else we should do?
That's really going to be, those things are really effective if you do them. One thing about RSV can stay alive on surfaces for a long period of time. So you have to be cautious about where you go. It can stay alive on hands for even like 30 minutes, sometimes more. So you have good hand washing is paramount in that. But it can stay alive on surfaces, hard surfaces, for hours. And so you have to be very cautious about where you lay your child, the places you're going to. Public places for right now, probably not the best idea. Okay. Just go ahead and stay home and start that fire and sing those carols and do that. But I think that limiting the contact is going to be paramount.
Okay. Tis the season.
Tis the season indeed.
Dr. Eric Yancey, thanks very much for being here.
Thank you. All right, sure.
Dr. Yancey also talked about the RSV vaccine. We talked about that earlier this afternoon. Expectant mothers can get that vaccine. Also for infants. The thing is, it can be tough to find right now. So the hope is, Dr. Yancey said, that eventually that will be more easily found in terms of a vaccine, so you can prevent some of the worst symptoms if you do get sick.
Yeah, I know a lot of parents have mixed feelings about vaccinating their kids, especially in today's world, but our job is to present you with the science and what the experts are saying, so you can make the best decisions for your family.
And wash those hands.
Yes, those are basic things that we should all be doing.
We'll share the full sit-down interview with you to watch. Just head online. We've got it at WTHR.com/SceneOnTV.